Phobias are irrational fears that sometimes develop through classical conditioning. In the early 1900s, John Watson classically conditioned infants to fear white rats, and the children's fears generalized to other furry animals. This baby has learned to fear rabbits. Even a cardboard cutout of a rabbit makes him very afraid. As you can tell, the baby likes his porridge very much. But if he should happen to think about a rabbit or see one on TV, or if a rabbit pops up, his fear takes over. The rabbit is a conditioned stimulus that elicits the conditioned response of fear. By using classical conditioning, we'll see how the baby, and many people who suffer from phobias, can use behavioral therapies to reduce their fears. The two treatments we'll look at are counter-conditioning and systematic desensitization. The goals of counter-conditioning and systematic desensitization are to get the person to replace or counter the anxiety associated with the feared stimulus with a good feeling instead. In the case of the baby, we'll present the rabbit whenever the baby gets his porridge. We want to replace the conditioned fear to the rabbit with a new conditioned response, namely the good feeling he associates with his porridge. The idea is the baby will learn the rabbit is associated with good things, and this knowledge will reduce his fears. But we have to do this in small steps. Instead of immediately pairing the rabbit with the porridge, we show him a small rabbit, but just for a little while. When he's comfortable with the small rabbit, we gradually introduce larger rabbits, and then begin moving them toward him. We're careful to allow the baby to gradually counter his fear with the good feeling he gets from eating his porridge. In this way, he has learned to overcome his phobia of rabbits.